This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
You know, summertime can be a really busy time, especially if you're a mom, you're running your kids to this place and to that place. And if you're working full time, it's even that more busier. So sometimes you feel like you don't have any time to focus on your health.
Right. Now, if you really have a problem, well, you've got to stop what you're doing and go to the doctor. But if you just have a question about your health, well, guess what? The doctor is in on Delmarva Life. As a matter of fact, Chief Informatics Officer and Hospitalist Dr. Snyder is the doctor on call for questions that you, our viewers, send to us. However, we have to do something first as we welcome you back to the show this afternoon.
Thanks for having me.
Congratulations on your promotion.
Thank you.
Now, you are now officially
Chief Safety Officer. So
what's that mean?
It's a role in healthcare that really, historically, Peninsula has never had this, but our new CEO decided to move a physician into that role because obviously, operationally, we're a little bit engaged in patient care. So, and I've worked in quality and utilization in the past. So this is a role just moving me into a little higher level of partnership between the providers, the staff, and ensuring we have good guardrails around safety issues in the hospital, so in the community too. So I'm really excited about it. It's very challenging.
Yeah, congratulations on that. Okay, but you're still going to come around here for Ask the Doc.
Yes, I will.
Yeah, good. That's your most important job.
Most definitely.
So we have some questions for you, and this question is from a viewer who asks, can myoplasty of the eardrum affect a child's hearing after it is done?
So yeah, these the patches they'll put over holes that occur in the eardrum after a hole occurs from an infection. So
that's what myoplasty
it's actually pretty normal. Yes. So actually that patch does make a little thicker covering of that eardrum, but it's actually thin enough that it really has very little effect on hearing. So most cases are very good outcome with that.
So myoplasty is the eardrum?
Yeah,
breaking?
so the eardrum pops usually as a result of an infection in the middle ear.
Gotcha.
The middle ear gets a lot of pus in it, and that pressure relieves itself. It's Mother Nature's way of taking care of the infection, actually. So you can get a hole. You can also get it from deep dives or swimming or injury or trauma to the eardrum. So those things being said, when they do patch it, that thickness layer is typically pretty equal to what the eardrum is, and Mother Nature, again, heals itself. You do have a little bit of scar, but it's so minimal, usually the hearing deficits. And again, depends on the size of the hole, too. And we're talking millimeters, hundreds of a millimeter. So
teeny tiny.
Yes.
Gotcha. Okay, let's see. I recently had blood work done, and it revealed that I had an elevated potassium level. What causes that, and is it dangerous?
So yeah, high levels of potassium can be really dangerous. We see it a lot associated with certain medications. We also see it complicated in dialysis patients and diabetics who have what's called diabetic ketoacidosis. So when the potassium level goes up, potassium is one of those things that stabilizes your electrical system in your heart in a nutshell. The heart has an electrical system around, and one of the major events that can occur is cardiac arrest or heart attacks associated with electrical changes that occur because the potassium levels are too high. It affects the way the heart uses the chemicals in the body to engage the heart in a normal pumping motion.
Right.
When the potassium goes up, it drowns that out basically, so you can actually have a short circuit, and it can create a pretty bad event. So it can be dangerous. Potassium supplements are one of the more common areas where we see high potassium. So if you're on diuretics or medications, we may give you some. So that's one of the common events that occurs. We see it more commonly, like I said, in dialysis or kidney patients, just because that's how you get rid of potassium in your body. It comes out through your daily practice of urination. And again, if you're not urinating, or if you're a dialysis patient, obviously that would put you at risk for high potassium.
Very interesting. Okay, here's another one. It seems like every day we're hearing about another food recall because of salmonella risk. What is it, and how would you know if you even had it?
Yeah, salmonella is, and usually it's dairy products that you find it in. This time of year is real bad, so the egg salad's sitting on the picnic table all day, and then somebody goes grabs a scoop at the end of the day. So the salmonella is a bacteria that really can create a very bad diarrhea. In certain people, it can be very dangerous. Most people tolerate it and don't need any treatment at all. They typically have 2 or 3 days of diarrhea. Those that get bloody diarrhea and become compromised are the ones that can create the problem. But it's actually fairly common. And again, most most of the time it's self-limiting in young people. It's when the elderly or the sick get it where we get real problems, but it can cause a pretty significant diarrhea.
It can definitely make you miserable, right?
Absolutely. It's type food poisoning.
Yeah.
We'll call it. Yeah. So it causes a pretty severe diarrhea.
All right, there you have it. Dr. Chris Snyder,
Chief Safety Officer.
I got to get used to saying that.
Yeah.
So,
It's a little shorter than your last title, so we're good there.
Yes,
All
yes.
right, we'll see you next month. And of course, if you have any questions, just email them to us here at Delmarva Life.